Thanks, Jordan. Today in Your Health with Bellin, radiation therapy is a common way to treat many types of cancer, but it can also damage skin, making it harder for surgical and other wounds to heal properly.
We are talking about it today with Dr. Rance Hefner from the Bellin Health Wound Healing Center. He's going to help us heal. Good morning.
Good morning. How are you?
Good. Let's talk a little bit about how would you define a wound that won't heal?
A wound that won't heal is typically something that lasts for longer than 30 days.
Okay.
And these wounds can be complex. They can lead to lots of things like an amputation of a finger or a toe or something like that. Very challenging sometimes.
So what are some of the most common reasons a wound doesn't heal?
It doesn't have good nutrition, doesn't have good oxygen, it's infected, stuff like that.
All right, let's talk a little bit about radiation therapy. This is something that had not occurred to me before. It can be a life-saving treatment for cancer, but it can lead to this issue. How's that?
Well, radiation therapy, what it does is it gets rid of tissue or cells that are causing problems. So the after effect of that is like a scar, and it's hard to recreate normal tissue within that area. You're alive, but you've got problems within that tissue, and sometimes this can be a real delayed problem that comes up years later, and there's really no great way to heal it. And that's why we have things like hyperbaric oxygen treatment.
Well, didn't you say that one of your first patients at the Wound Healing Center was a mastectomy patient,
Yes.
right? And you were
Yes.
able to help her.
That's right. She had problems for almost over 20 years and eventually came in, one of the first treatment of hyperbaric for Bellin, and she eventually healed. Something that was just a chronic oozing wound that eventually got better.
Let's talk a bit about that treatment. How does it work, and talk a bit about the process?
Well, the chambers that Bellin has are like a big tube, acrylic tube that you lay in, you basically get pushed into. We control the oxygen level, and you lay there and you can like watch TV, watch this show, things like that, or some DVD that you want to watch, and you're in there for like 90 minutes at a time, 5 days a week for up to 12 weeks. It's a very interesting thing. Some people have some problems with things like their hearing or pressure in their ears, but other than that, most people tolerate it very, very well.
But it must be a truly effective treatment, right?
It's effective in almost 75% of people, and it gets to the point where you can't get enough oxygen into the cells, and that's what this procedure does. It helps get oxygen to the level of the cell.
I'd imagine this is a complement to other treatments you offer. What
Yes.
else can we experience at the wound clinic?
Wound Clinic has a broad range of things, a great team. We do things like debridement. We have special products that help wounds heal. It's just a great, great service for a select number of people.
Sure. But in other words, don't just live with that wound,
Correct.
right?
Correct. There's always options.
All right. Well, if you'd like to find out more about this type of treatment, call the Bellin Health Wound Healing Center, 920-433-7550.
You can also visit bellin.org, then click on Services and Programs, and then you'll find the Wound Healing Center. Thanks for the topic.
Thank you very much.
You.